Given what happened in Tucson, given the current laws on mental health in the United States, could Gerald Lee Loughner have been stopped from purchasing a gun or been treated at some point, given what we've learned about him over the last week or so?
No, I think both. Arizona has one of the broadest civil commitment laws in this country.
And what does that mean?
It's actually very easy to get someone evaluated in Arizona. The standard for getting someone before a mental health professional is actually broader and actually simpler. What's interesting is that at a number of points along the way, Mr. Loughner could have been evaluated by a mobile team. They have a 24-hour crisis program. At some point, in
Arizona,
the college police could have called in a mobile crisis team to evaluate Mr. Loughner. At some point, the university could have taken that responsibility. You know, we see this horrific incident as being really a failure to intervene early and a failure to get treatment to Mr. Loughner when he needed it. And we understand that university and colleges and community colleges are very busy. They see hundreds and thousands of students every day. But this is such a, if you sort of backtrack and look at this situation, he was involved with the campus police 5 times. Numerous instructors knew that Mr. Loughner was having significant mental health problems. In Arizona, again, it's relatively easy simply to pick up the phone and ask for intervention.
What about his parents? Could they also as well?
Well,
after he was 18.
Yeah, we're not clear in terms of his role with his parents, and I think that's coming out now. I think the reality is, too often, what we know is that any given day, half the people in this country who have mental health problems receive no treatment, and much of that has to do with really the stigma, pervasive stigma around mental illness, and the lack of knowledge, and in some cases, parents, friends, and acquaintances just have no idea what they're seeing. And if and then again, if they understand that perhaps it's a mental health problem, have no idea where to get treatment. The challenge is, and if you look particularly since 2009 in the recession in this country, and I can give you a couple of examples. In West Virginia, after Virginia Tech, the assembly in Virginia and the governor passed legislation that brought, I think, as much as $43 million new money into the system to sort of build up the system, make it more accessible and more robust. Since then, because of the recession, most of that money's gone. It's been cut because of the realization that states and counties functionally run the mental health systems in this country. Arizona has had the same problem. We do a grading report periodically of all the states in the country. Arizona last time got a C, went up from a D. It was a system that was beginning to grow and be more vibrant and more accessible. Much of that money's been cut since then. And so that's part of the challenge in this country, is really making state and local governments accountable for the systems that they develop, that citizens need to reach out to in times of difficulty.
A while back, a law was passed, I believe, a federal law for parity, health insurance parity for mental illness and physical illness. Is that correct? How is that? Has that been enacted fully?
The parity law has been, as of February of last year, the regulations were promulgated. The law is now the law of the land. We anticipate that over time, millions of Americans who currently don't have access to mental health care because they can't afford it, or either their insurance companies are denying them coverage, or their businesses currently don't offer coverage, will have an insurance card that will allow them to buy mental health services the same way you would buy services for any sort of medical condition. That's what parity is about. We think it's a game changer. We think it will make a tremendous impact on the lives of people in this country.